The aims of this video is to ensure the user can operate the Belmont Rapid Infuser device safely and competently. By the end of this, the user will be able to ensure the Belmont Rapid Infuser is appropriate for the intended use, be able to operate the Belmont Rapid Infuser safely and competently, be able to use the appropriate accessories, be able to respond to alerts and alarms, have knowledge of moving and handling ergonomics when moving or repositioning the Belmont Rapid Infuser, be able to clean and store the Belmont Rapid Infuser safely. This device is indicated for the rapid delivery of life-saving warmed blood and fluid. It is important to check for signs of damage, wear and faults, and also service date of the infuser. This device should only be used by staff who have been trained and assessed as competent as per the NUH Medical Devices Training Policy. The operator must ensure visual and functional checks are performed before use and ensure all accessories are available. The user needs to be able to appreciate how to mount the device on a drip stand at the appropriate height, demonstrate the lever for locking to the drip stand, ensure only Belmont drip stands are used, identify collar on drip stand for supporting the device and determining the height. Check the mains cable for obvious signs of damage. Check silicone cover and mains input socket is securely fitted. Check fan inlet filters on bottom of the device are free from dust buildup. Check MESU service sticker is on the device and do not use if out of service date. The device is serviced at 6 monthly intervals. How to install the disposable set. Open the disposable packaging and tighten the 2 lure locks which occasionally come loose during sterilization process. Snap the reservoir chamber into the reservoir support. Open the door of the unit and load the circular heat exchanger with red arrow pointing up and the red tubing aligned with the red line on the system. Align the red tubing on top of the red stripe and place the pressure chamber into the pressure channel. Press the infused line into the secondary air detector. Please note, the infused line should be within the air detector. Place the infused line to the left of the patient safety valve wand and place the thinner recirculation line to the right of the air detector and to the right of the valve wand. Fit the interlock block on top of the shelf. The blue arrow should be upright, pointing towards the ultrasonic air detector. Make sure the larger tubing is in the groove of the wider blue line, avoiding stretching, kinking or twisting of the tubing. The smaller tubing should be in the groove of the thinner blue line. Finally, close and latch the door, making certain the pump tubing is not caught. How to switch the device on. The device must be plugged into the SE mains power supply before being switched on. If switched on before connecting to the SE mains power supply, then the device will not function correctly, though it may appear to prime and operate properly. Press the power button firmly to the on position, located at the back of the device. Priming the unit must only be undertaken with the device connected to the external SE mains power supply. After a brief self-test and service screen option, operational instructions will be displayed on the screen. How to prime the rapid infuser once disposable set is installed. The device must be plugged into the mains power point and not a power extension or set lead. You must ensure that SE power present is shown on the startup screen, not on its internal battery. Once primed, please document on monitoring sticker who has primed the device, date and the time in order to track and trace, allowing the reviewing and monitoring of preparation of the device. Priming must be with sodium chloride 0.9%. Do not prime with Hartmann's as this cannot mix with the blood. The user must demonstrate knowledge of which products and solutions can be warmed with the device. Crystalloid fluids. Again, please do not use Hartmann's solution. Colloids, blood products, packed red blood cells, fresh frozen plasma, and processed anticoagulated blood. The user must demonstrate knowledge of which products and solutions cannot be warmed within the device. Platelets. Platelets can bond to the inner surfaces of the disposable set, reducing the amount of platelets reaching the patient and consequently affect the device operation. Cryoprecipitate. Cryoprecipitate should not run through a rapid infuser to prevent dilution. Granulocyte suspensions. Granulocyte are fragile cells and therefore should not be administered through a rapid infuser. Drugs and biological agents cannot be administered via the Belmont. How to change the infusion rate. Press and hold either the up and down infusion rate button on the display until the desired rate is reached. To infuse a fixed bolus volume, a single press of the bolus button will deliver the preset bolus to the patient. To change the bolus amount, the device must stop infusing. Then the bolus button can be held until the desired bolus amount is displayed. Available bolus options are 100 ml, 200 ml, 400 ml, 500 ml, and 1000 ml. Limitations or contraindications which may affect safe use of the device. This device should only be used by staff who have been trained and assessed as competent as per the NUH Medical Devices Training Policy. Do not add solutions containing calcium or other additives that would compromise the anticoagulants in blood products. Clots in blood products may block the flow of fluid and cause overheating. Do not use the device if temperature probes or disposable set windows are wet, dirty or blocked, as they can compromise the accuracy of the temperature probes and cause the unit to call for an increase of output temperature. Thoroughly clean the temperature probes and disposable set windows before each use. Do not use fluid stored in an overly high temperature fluid warming cabinets. The use of pre-warmed fluids is not necessary. Pre-warmed fluids that exceed the temperature limit will trigger an over-temperature alarm. In the event that the unit has displayed an overheat or over-temperature indication, discard and replace the disposable set and blood product. Assure an optimal infusion site with sufficient flow capability and appropriate cannula bore size to avoid overpressure indication. How to respond to alarms and alerts on the device. The system will alert the user with an audible alarm if it senses a problem and will display instructions for corrective measures. To return to normal operation, follow the instructions. The total weight of this device is 12.7 kilograms. Ensure a moving and handling risk assessment has been completed if required. Consider task, individual, load, environment and stability. If in doubt regarding the moving and handling of this device, contact your local moving and handling link person or the authorized trainer assessor for this device. What to do at the end of the procedure. Press stop on the device screen. Clamp the patient line and bag spikes. Disconnect from the patient. Turn off the system with the power switch at the rear of the device. Open the door and remove the disposable set. What factors may affect the safe operation or accuracy of the device? Please identify possible errors with the troubleshooting techniques and undertake remedial actions. What actions to take if there is an error or failure of the device? Remove the device from use after ensuring the patient is safe and unharmed. Complete a clinical engineering decontamination form detailing any error codes or messages. If the device is involved in an accident, ensure the DATEX number is recorded on the decontamination form. The device must be quarantined from use and the device is returned to clinical engineering as it was set up and used, including any consumables used. If this is not possible, take an image of the setup and ensure this is uploaded to the DATEX incident form. Error 101. In the event of Error 101 occurring during device use, thoroughly clean temperature probes and disposable set windows before each use with moistened cotton bud and thoroughly dry afterwards. The blue arrows show the location of the two temperature probes. The red arrows show the temperature probe holes that should be cleaned and dried if an Error 101 alarm occurs. If the error persists, clean the sensor as indicated by the blue arrow with cotton bud and dry. Air detection alarm. Open the door, squeeze tubing directly below air detector sensor to clear the air. Recirculate to remove air in the line. Reseat the tubing in the air detector sensor. Replace disposable set if there's a leak. If the door is open, close the door to silence the alarm and resume. If the error persists, clean the sensor as indicated by the blue arrow with a cotton bud and dry. Fluid out. Add fluid, open bag clamps, check bag spikes, reseat the tubing in fluid out sensor, Replace filter if it becomes clogged and check recirculate line. High pressure. Check the infusion site, use the appropriate cannula size, and check the patient line. Check recirculate line. Increase pressure limit setting. See Chapter 4 of Operator's Manual. Low battery. Plug system into AC outlet. Check power cord at the AC outlet and unit. How to clean and decontaminate the device. Clean the device following the NUH policy and our manufacturer's guidelines instructions using green Clinell wipes, ensuring all obvious signs of dirt and contamination are removed. Ensure fan inlet filters at the bottom of the device are free from dust buildup. How to store the device safely. Ensure the device is stored in a clean and dry environment. The Belmont Rapid Infuser must be plugged into AC main power supply using the supply power cord. The power cord is specific to this device only.